Good morning, everyone. Good morning, Dr. Roger.
Good morning. Good morning, everyone.
How are you today?
Good, good. Busy day.
Yes, and we like that. And I happen to know why you are busy because you are getting people access to healthcare, and you have a you have a story
Sometimes,
to share this morning.
sometimes urgency comes up, or emergency or urgency, and folks don't know what to do. Sometimes when somebody is sick or bleeding, they don't know what to do. So if they can't reach their doctor, the first thing that comes in their mind is to the emergency room. My stomach hurts. Oh, the doctor's office is closed, or the doctor's office is not answering. So they just go. Now, so what happened this morning, um, was one of our member patients who is what we call like a sponsored member. That means the employer, the small employer, is buying the memberships for his people. This employer has like a couple dozen people.
Mhm.
And so the formal kind of healthcare with Blue Cross or United is not in their price range. Um, so in order to provide the healthcare benefit, they just buy the memberships for the employers. So one of his employees reached out to us this morning with a problem, and it involved blood. I can't say much more, but so I called him right away and found out what was happening, and I knew that he needed a specialist, okay, to take a look at this problem. It was not something that I could bring him into the clinic to evaluate and take care of in the clinic. I couldn't do all of the tests I need in the clinic. He needed to be in the hospital. So I called um, the hospitalist friend of mine and told him what the problem was. And he's like, okay, I'll get him admitted. And I said, do you feel like he needs to go to the emergency room with this problem, or can he be directly admitted to the hospital? He says, no, I'll get a direct admission, and we will get him to see the specialist right away. So he was, by the time that I did that and just explained the problem to my friend, the hospitalist, he was already asking for his name and date of birth, so
Hmm.
he could make the connection with the admissions office. So then I texted the patient back through our HIPAA compliant secure messaging app, like, go to this hospital, go to the admissions office, they're waiting for you. This is the admitting doctor. This is the name of the specialist that's going to see you today. So perfect. That's the way healthcare should be. I mean, that's the way it used to be back in the day, with our parents and stuff.
Mhm.
The treating doctor would either admit the patient to the hospital himself, or he would just call the hospital and talk to one of his colleagues there and tell them what the problem was, doctor to doctor, and they'd have them ready. And so, unfortunately, and the way that healthcare has changed over time is it's hard to access your primary care doctor. So people, unfortunately, have to use the emergency room a lot more.
Hmm.
Um, so that's the beauty of direct primary care. Me as a doctor, I'm connected with other doctors, with other specialists. And this is the second time, actually, with this patient that we were able to bypass the emergency room.
Yeah,
Um,
that is, when you told me that story, I guess I live in a dream world where I think, when you told me I was able to directly admit him to the hospital, I thought, well, isn't that normal? Like, I guess I watch too much TV where anyone who needs to be in the hospital gets admitted without problem. But you're telling me that is not necessarily the reality. So had it not been for your help, what would have most likely the journey looked like for that person?
Well, if anybody is listening and they have a doctor that they can call on the phone or send them a text message and get them directly admitted, that's wonderful. I mean, hold on to that because that's valuable. But for the most part, family practice docs have their schedules booked, and they hardly have time for anything, much less take a phone call from a patient or a text message that they're not getting reimbursed for by the insurance company. So if they have a patient that has an acute problem that needs to be evaluated, they just tell them go to the emergency room, and then they let the emergency room sort it out and make the connection to the specialist or admit them to the hospital if they need that.
So they're not even interested in that type of quote unquote business. That's interesting. Why are they not interested in doing that?
Well, like I said, their schedule is usually so filled up with patients in the room. Most people and most primary care doctor offices have their waiting room full and their schedule so full that it takes days or weeks for a person to get in to see their doctor.
So why are you not in that situation? It's most certainly not because people don't love you, but because you have a smarter way of doing it.
Well, fortunately, I was able to stop working in that system and establish the direct primary care model, where I am not in this model working for the insurance company who is paying me to see patients that are paying premiums to them. In this model, the individual patient or the employer for their employees are paying me directly. So my interest is my patient. I'm going to take care of them. And because they pay a monthly fee to the clinic, I'm already getting paid. So I don't have to spend time having somebody come in and generate charges to submit to the third-party insurance company to get reimbursed for seeing their patient. Mm-hmm. These people that pay the membership fee to the clinic, that's my patient. They're our patients. I'm not sure if everybody that's listening might know or make the connection, but really the insurance company that you're paying your insurance premiums to, you belong to them, sort of, mm-hmm. And you feel that too. Like sometimes you might change jobs and then you have to change doctors because your new employer is contracting with a different insurance company. It's not Blue Cross anymore, it's United, for example. Mm-hmm. So in this model, we are connected directly with our patients. So we work directly for them, and we're able to work this way.
Well, I love it. And I know you have to get to another meeting. So I just one final question. But before I ask you that, go to the link that is shown in the ticker, link.directmedclinic.com/employers. If you are an employer and you want to offer that great health benefit to your team, definitely check that out. Otherwise, if you're an individual or family, reach out to Dr. Roger. But my final question is, how much time and money might you have saved that person you were referring to?
Well, that's a great question. Just think of how much it costs to go to the emergency room, and think of how long you have to wait. I mean, the stories are out there about how long people have to wait and what kind of bills people get from the emergency room. what happened today with me, that employer and that patient is not getting a bill from the office. But look at the great high level of care they got. I mean, in a matter of a few minutes, by me talking to my patient on the phone, I knew what his problem was, and I could hang up with him, call the specialist, and describe the problem. And now, as he goes to the next level of care, being directly admitted to the hospital, they're going to be able to differentiate the problem right away with the specialist. He won't have to go to the emergency room, and then the emergency room doctor has to get all this history and learn about the patient, and then call. He's got to make a decision whether the patient needs to be admitted or can go home.
Mm-hmm.
Okay? So in this case, probably is going to be an admission. So he's got to admit the patient, and then once he gets admitted, then in the hospital, the attending physician is going to have to go see him and then make a decision whether he needs to have a specialist involved to see him. So there's a number of steps there that we've already just zoomed right past.
Mm-hmm. Well, I think it's safe to say that you saved that person probably thousands of dollars, the employer thousands of dollars, and most importantly, really, by saving time always in medicine.
And let's not forget the first point I made. Sometimes people don't need to go to the emergency room, but they just don't know if what they have is serious or not. So if you can text your doctor or have the doctor call you, the doctor can triage you right on the phone and give you a level of comfort. Like yes, we need to see you today, or no, let me do this for you and let's see how you're doing tomorrow. Or say, no, you need to go to the emergency room.
Mm-hmm. Yep. Well,
it's the access that is so missing for so many people these days. You know, the government a few years ago mandated that everybody should have insurance, but that's not access to care. You know, direct primary care is access to care, and that's what we want people to know about, that there's affordable access to health care.
Yeah, well, I mean, I think today was a very, very insightful session, and thank you so much for everything you do for the community. And again, for our viewers, if you have questions, go to the comment section, ask your questions, reach out to Dr. Roger directly, and we'll see each other again next week.
Very good.
Have a great rest of your day.
Okay. Bye, everybody. Thanks,
Bye.